Hi, this is Steven and welcome to my YouTube channel. Today we're going to talk about case studies that are being used in genetics. But before that, don't forget to like and subscribe below. So we are going to presenting you some case studies that we are using in the medical field or healthcare field, or sometimes in biology or genetics. So these are the case studies that are very useful in formulating hypotheses, formulating ideas, and it's also a good step on how you improve your critical analysis when you read these case studies. But before that, we're going to explore what are case studies. Okay, these are the particular photo coming from Jared Ludwig from the National Geographic channel. Okay, these patients on your left are patients from the thyroid center in Minsk, Belarus. They are getting treatment for the destructive effects of radiation, okay, to the thyroid gland after being exposed to the fallout from the Chernobyl nuclear accident in 1986. And the article states that children, okay, born to Chernobyl survivors do not carry these genetic mutations, and it is being proven, okay, in the article that the past results or the updates from these past results will not just only tell us the advances, okay, or the current status of these children, but also it will also provide us an idea or information that how the fallout, okay, from the disaster caused certain cancers. And it's a good study to begin with in our field. So case studies, okay, let's talk about what are case study and how are we going to prepare ourselves when we are presented with a case study. So a case study is an up close or in-depth and detailed examination of a particular case or cases, and it works with a real world context. Okay, for example, case studies that were used in medicine may focus on an individual patient or ailment. Okay, and the following case studies that I will be presenting to you are focusing on the individual patients or ailments. So these are case studies that are selected case studies in genetics. Okay, they have commonly seen as a fruitful way to come up with a hypothesis and also to generate theories. Case studies are also useful for formulating concepts, which is an important aspect of a theory construction. So case studies or teaching case studies in the country or in the Philippines are not popularized, okay, but in the US or in the Western countries, they have become increasingly popular, especially in science education. But it's not limited to science education. You can also use that one in history, arts, humanities, business, and politics. Okay, so the National Center for Case Studies in Teaching Science has made a growing body of available teacher resources in case studies for classroom use, and they're also using these case studies, okay, to enrich their students' critical thinking skills. So I'm gonna talk about 5 case studies and read all of them in genetics. And the first case study that I'm presenting with you is this case study: should a child be deaf? Okay, this is our first case study in the genetics, and I'm gonna read the scenario. Okay, researching their family histories, a deaf couple learns that some of their relatives back through several generations were also deaf. Okay, they have hearing disabilities. They plan to have a family and decide to discuss with a clinical geneticist the possibility that some or all of their children may be deaf. The geneticist informs them that without intervention, they are very likely to will have a combination of deaf and normal hearing children. But that is by using a combination of embryo testing and in vitro fertilization. It will be possible to select embryos with normal hearing for implantation, and the couple opts for this method, and their first child has a normal hearing. So you see a photo on the left. It's not a part of the family, okay, or the couple. It's an audiologist conducting a hearing test in a soundproof room. So the problem here is, how do this couple, okay, um, produce an offspring, okay, which is not inherited with this disease, okay, or deafness that runs through their family. So there are following questions that you need to answer after reading this case study. So it's up to you which will come first, but all of these questions will be answered right away. First question is it likely that these parents inherited their deafness as a recessive or dominant trait? What observations in your family histories would support either conclusion? That's the first question. Second question, if the parents had asked to select embryos for deafness so that the child would share the characteristics and culture of his or her parents, would it be ethical for the physicians at the clinic to agree to test embryos for the presence of deafness and select these embryos for implantation? So here, the parents are trying to share a little bit of their identity, okay, from his or her parents, and the question now relies on the physicians, okay? Would it be ethical for the physicians at the clinic to agree, okay, to test these embryos which are having this deafness trait, okay, and select these embryos for implantation? So these are the questions from our first case study. Our next case study is all about the helping or hurting. A case study 2 in genetics. I'm gonna read the message. Robert syndrome is a rare inherited disorder which are characterized by facial defects as well as severe limb shortening, extra digits, and deformities of the knees and ankles. And there is a cytogenetic analysis of patients with Robert syndrome using the GEMSA staining or the C banding, and revealing that there is a premature separation of centromeres and other heterochromatic regions during mitotic metaphase instead of anaphase. A couple with an infected infant is contacted by a local organization dedicated to promoting research on rare genetic diseases, asking if they can photograph the infant as a part of a campaign to obtain funding for these conditions. The couple learned that the privacy of such medical images is not well protected, and they often are subsequently displayed on public websites. The couple was torn between helping to raise awareness and promoting research on this condition and sheltering their child from inappropriate use of these images. Several questions have been raised. So that photo on your left is not the photo that is coming from this case study. That's a photo from J.B. Roberts, okay? A child with a double cleft of lip and palate, the protrusion of its intermaxillary portion of the upper jaw, and an imperfect development of the bones and of the four extremities. So this is coming from the Annals of Surgery in Philadelphia, year 1919. So after reading this question and this problem, I'm gonna go to the questions that you're gonna answer. So the first question is, in Robert syndrome, how could premature separation of centromeres during mitosis cause the wide range of phenotypic deficiencies? Second, what ethical obligations do the parents owe their child in this situation and to helping others with Robert syndrome by allowing images of their child to be used in raising awareness for this disorder? And lastly, if the parents decide to allow their infant to be photographed, what steps should a local organization will take to ensure the appropriate use and distribution of photos? So this question or this case study is going to talk about ethical issues, okay? How are the researchers at the same time protect the identity of the patient and promote awareness among the public? So that's the second case study. And now we're going to talk about the third case study, which is the treatment dilemmas, okay? And it goes like this. A 30-year-old woman was undergoing a therapy for beta thalassemia. This is a recessive trait caused by absence or reduced synthesis of the hemoglobin beta chain, which is a subunit of an oxygen-carrying molecule in your red blood cells. In this condition, red blood cells are rapidly destroyed, okay, which freeing a large amount of iron, which is deposited in tissues and organs. The blood transfusions the patient had received every 2 or 3 weeks since the age of 7 to stave off anemia were further aggravating iron buildup. So there is an iron buildup within the tissues of this patient, of this 30-year-old woman. Her major organs were showing damage and she was in danger of death from cardiac disease. Her physician suggested that she consider undergoing a hematopoietic stem cell transplant, or the HSCT, since these stem cells give rise to red blood cells. Such a transplant could potentially restore her health. While this might seem like an easy decision, it is not. Okay? Advanced cases have a high risk, almost 30% for translation or transplantation related death. And at this point, the woman is faced with a difficult and important decision. So this disease, or the beta thalassemia, is a rare, okay, a group of inherited blood disorders, and these forms of thalassemia are caused by reduced or absent synthesis of the beta chains of your hemoglobin that result in a variable or ranging from a severe anemia to a clinically asymptomatic individuals. And globally, okay, when we study epidemiology, the annual incidence is estimated at 100,000 individuals are affected with beta thalassemia, and it's occurring on the malfunctions of the hemoglobin subunit, or the HBB. And this disease, okay, depends on the nature of mutation. So let's gonna talk about the questions. Consider different ways in which a mutation, or a single base pair change, or a small deletion in the gene encoding hemoglobin beta chain could lead to beta thalassemia. For example, how might mutations in promoter, enhancer, or coding regions yield this outcome? And why is it important that the physician will emphasize to the patient that she must bear the responsibility for her final decision? That once she has considered all the aspects of the decision, she act autonomously. And if you are facing with this decision, what further input might you seek? Are you gonna go with stem cell therapy or not? So that's our third case study. Our fourth case study will be called as the unexpected diagnosis, and it goes this. 6-month pregnant, an expectant mother had a routine ultrasound that showed that the limbs of the fetus were unusually short. Her physician suspected that the baby might have a genetic form of dwarfism. We call it the achondroplasia, an autosomal dominant trait occurring with a frequency of about 1 in 27,000 births. The patients were directed to a genetic counselor to discuss this diagnosis. In the conference, they learned that achondroplasia is caused by a mutant allele. Sometimes it is passed from one generation to another, but in 80% of all the cases, this is a result of a spontaneous mutation that arises in the gamete of one of the parents, either the mom or the dad. They also learned that most children with achondroplasia have normal intelligence and a normal stature. So these are the following questions that will be answered by you. The first question is, what information would be most relevant to concluding which of the mutation origins, inherited or new, most likely pertains in this case, and how does this conclusion impact on this decision in deciding to have more children? And number 2, it has been suggested that prenatal genetic testing for achondroplasia be made available and offered to all women. Would you agree with this initiative? Okay, and what ethical considerations would you consider when evaluating the medical and societal consequences of offering such testing? So this is more likely on the acceptance or the decision of women to be genetically tested, okay, or for prenatal genetic testing for achondroplasia. And lastly, we're going to talk about the fifth case study, the last case study for this series of case studies, about cancer-killing bacteria. And it goes like this. Ralph, a 57-year-old man, was diagnosed with colon cancer. Okay? His oncologist discussed that the use of radiation and chemotherapy as treatments, both of which can cause debilitating side effects. Ralph decided to explore other options and went to a cancer clinic. He learned that researchers in a synthetic biology program were testing the use of genetically modified bacterial cells designed to selectively invade specific tumors and kill cancer cells. And it doesn't have an effect on the normal cells. Ralph decided to participate and was informed that he would be a part of the phase 3 trial, comparing the effects of a modified bacterial cell treatment against the conventional or harmful chemotherapy. And however, as a part of the trial, he would be randomly assigned to receive one or the other treatment. Okay? He was very disappointed to learn this because he assumed that he would receive this bacterial therapy. And cancer, as you may know, back in our lesson in the cell cycle, this is the abnormality, okay, of the processes where the cells weren't really coming up into a full vitality when they pass through the different stages of your cell cycle. They are not, okay, properly checked using the checkpoints, and thus giving us an abnormal tissue replicating and duplicating themselves abnormally inside the body of the organism. So this colorectal cancer is really one of the most, okay, debilitating disease or cancer in the world, and it has a result in about 1 million people will get colorectal cancer every year. Okay, and the result of it will be 715,000 deaths as of 2010, and 490,000 in 1990, and as of 2012 it is the most common cancer in women, okay, and third most common in men. This is coming after cancer deaths in lung cancer, okay, stomach and liver cancer. So these are the following questions that you would answer. Informed consent is legally and ethically required before someone participates in a clinical trial. After potential participants receive information about the trial and what constitutes informed consent, research indicates that 25% of prospective participants do not understand that these trials are designed primarily to establish the efficacy of the treatment rather than directly benefit the participants. What should the investigators do to make sure that clinical trial participants understand that the trial is not primarily to intend to help them, like in the Ralph's position or in Ralph's case? Okay, second, if you were in Ralph's position, would you try radiation and chemotherapy instead, or enroll in the trial on the chance that you might be receiving the bacterial therapy, which may or may not be more effective than the conventional therapy? Or could you just like want to read more about this bacterial therapy that destroys the cancer cells, okay, instead of the normal cells? And lastly, if you agree to participate and then learn that you will not be receiving the bacterial treatment, would you be ethically bound to continue in the trial? So these are the following questions that the patient must choose, okay, before knowing that he might be receiving, it's either of the conventional or the one which is recently discovered this treatment in treating the colorectal cancer. So those are the 5 case studies that you're gonna explore more about. Okay, I'm gonna give you further insights in my YouTube channel, what videos might help you, what lectures might help you in learning this case studies. So thank you so much for listening, and I hope that you've enjoyed watching our case studies in genetics. Bye bye.